My name is Lynn Sugarek, and I'm the diabetes educator at the Lighthouse of Houston. I just wanted to come on here and do this WebEx presentation on emergency preparedness. It's especially appropriate right now in this time of year, being that we're in Houston in the middle of hurricane season. This is just one of the start of multiple videos that we're going to be putting out, just discussing different topics about health, technology, different things. And so what I'm going to do today is just talk about different types of emergency situations, and then I'll go into what sort of supplies and documents that you should try to have on hand in case of these sorts of situations. So types of emergency situations. Major storms such as hurricanes are a big one, especially here in Houston. That's one of the main emergency situations we would have. But it could also be tornadoes, ice storms, different things. Loss of electricity, also evacuation. So if you do have to leave your house and travel to another city or just another house nearby, you want to make sure you know what sorts of supplies you need to have on hand to take with you. So what should I have in case of an emergency? So some general supplies that you do want to make sure you have on hand are a first aid kit. You want to have extra clothing with you. Make sure you have your cell phone and charger. Take a flashlight, or if you're at home, make sure you have a flashlight at home in case you lose electricity, because then you won't have light to see around the house if it's nighttime. You want to make sure you have batteries, especially in case of electricity loss. The outlets won't work. You want to also make sure you have a copy of your photo ID and health insurance card and have cash on hand. This is important because if there's no electricity, then you can't use ATMs or debit card machines might not work. So make sure that you do have cash on hand with you. So some food supplies that can be good to have on hand in case of an emergency are bottled water. You want to make sure you have bottled water just in case the running water that we have gets dirty or it's not clean enough to use. So you need to have bottled water to drink and also to use for brushing your teeth or different things as well. It's important to make sure you have non-perishable food items to eat. This could be, examples of this would be prepackaged or canned tuna, canned vegetables, beans, dried fruit. Also, granola bars are an easy thing that are good to keep on hand. Nuts and nut butters, also crackers. Those are good examples of foods to have just because you could always make peanut butter and crackers, and those are going to stay good for a while. So the whole idea is to make sure that you have food that you could keep on hand for a while in case of emergency that doesn't have to be refrigerated, that doesn't have to be put in a freezer. So now I'm just going to go through some general tips for emergency situations. If the electricity goes out, it is important to remember to consume perishable food from the refrigerator in the pantry first, and then use foods from the freezer after that. You want to make sure that you're eating foods from the refrigerator first because they will not stay as cold for as long, so they will go bad quicker. If you keep the freezer shut and you don't open it very much, the food in there can normally stay safe to eat for a couple days. So it is important also to try to minimize the amount of times you open the refrigerator or freezer door to try to keep the cold in there if you don't have electricity. Canned food can also be eaten directly out of the can, so just remember that in case you have an electric stove and you're not able to heat up any food, you can eat canned food. Store at least 1 gallon of water per family member per day. And this takes into consideration the amount of water you would need for drinking as well as for food preparation and hygiene. And if at all possible, it is good to consider storing at least a 2-week supply of water for each family member. I know not everybody has enough room in their house to store this much water, but if you do have an extra storage closet or somewhere where you can have this water in hand, it would be helpful. Especially, I would encourage you to try to have these to prepare ahead of time, like especially hurricane season is over the summer. So I would say in May, the beginning of June, that's when I would try to stock up on these things and have them at home so that once there is a hurricane coming, or if you are in an emergency situation, you're not having to panic and rush out to the grocery store and try to find supplies. I'm going to talk a little bit about diabetes specifically right now. So, if you do have diabetes and you're listening to this, it is especially important to remember to bring certain things with you in case of an emergency. And remember, this is in case you stay home, in case you have to evacuate and go somewhere. You want to make sure that you have your glucometer and plenty of testing supplies. I would encourage you to have enough testing supplies to get you through 2 weeks of testing your blood sugar level. So that's just dependent on how many times a day you check your blood sugar. Make sure you have your lancing device, the machine that you use to prick your to prick your finger. Make sure you have plenty of lancets and test strips, and also extra batteries if needed. This can be especially important if you have a glucometer that requires batteries. You need to have those. And then also, if you have an extra glucometer around, that would be helpful to take with you, just in case something happens to the first one. Also, make sure you have alcohol swabs. These are important for making sure that you're cleaning your skin well before you prick your finger when you do your blood sugar checks. And also, it's important in case you inject insulin. You want to make sure that you're cleaning the skin well so that you don't get bacteria. It is important if you do take any sort of diabetes medications that you want to make sure that you take any oral diabetes medications with you. Also take insulin with you as well if you take that. So if you use insulin pens or vials, make sure you take enough of those with you to get through 2 weeks. Make sure you take your pin needles or syringes depending on what you use. But especially if you're going out of town, you may not be able to go to a pharmacy and get refills. So that's why I do encourage you to have enough medication on hand to get you through a couple weeks, especially during the summer or even the winter times where you might be in more of an emergency situation. I would just encourage you to refill your prescriptions before they get to the very lowest amount. I wouldn't wait till the last day possible to refill your medications. I would make sure you have, at least like 5 days worth of supplies on hand. If you use a CGM or insulin pump, make sure that you take that with you or that you have the supplies you need for that at home. Take a sharps container with you. If you don't have a sharps container, this could also be an empty laundry detergent bottle. So it is important to remember if you're disposing of any sort of insulin, pin needles, syringes, any sort of lancets, you don't want to dispose of those in plastic water bottles just because they're a little bit too thin. But something like an empty laundry detergent bottle where the plastic's a little bit thicker, it is okay to use those to dispose of sharps. Now, what you want to do is tape around the top where it closes and then mark it when you put it in the trash so that people know what it is. You don't want anybody to get injured. It's also important to make sure that you keep items to treat low blood sugar on hand. So make sure that you have juice boxes or glucose tablets, hard candies, things like that in case your blood sugar goes less than 70. Glucose tablets you can get at CVS or Walgreens, Walmart, stores like that. It's a little tube of essentially they're just little sugar tablets that are chewable. And so if you are having low blood sugar, you can just chew on 3 to 4 of those and it should bring the blood sugar back up within about 15 minutes. If you do use insulin, I would recommend having a glucagon kit on hand as well, just in case you are not conscious and somebody else needs to inject the glucagon into you. One other thing I want to talk about is just some documents that you want to make sure that you have on hand in case of an emergency. This is also geared towards people with diabetes, but this would apply to different medical conditions as well. So it is, if you have diabetes, it is helpful to have a diabetes kit ready to go in case you have to evacuate. And so you want to try to keep the documents in a waterproof bag, something that's easy to carry, something that's portable. And so some of the documents that this should contain would be a paper stating what type of diabetes you have. You want to make sure that somebody knows if you have type 1 diabetes, type 2 diabetes in case of an emergency. It's also important to list any other medical conditions, allergies, and previous surgeries on there. I would include food allergies and medications that you're allergic to as well. Be sure to have a document with your doctor's name, phone number, and address on there as well. I would say it would be good to list your primary care physician and then any specialist that you use regularly as well. A copy of your most recent lab results can be good to have on hand. So especially if you have diabetes, some labs that would be important would be a hemoglobin A1C, your glucose levels. So just make sure that whenever you get lab results, I would just go ahead and make a copy and put them in this little kit for you to have ready to go. You also want to make sure that you have information such as make, model, and serial number of a CGM or an insulin pump if you use one. The CGM is a continuous glucose monitor. But this is important because let's say you go out of town, you end up having to stay there for a while. You want to make sure that the pharmacy knows what type of machine you're using. It's also important to have emergency contacts listed in case anything happens to you and you have any family members or friends that need to be contacted for you. So make sure you include their names, their relationship to you, their phone numbers, and some different ideas of emergency contacts would be family, friends, and coworkers. So this concludes the presentation on emergency preparedness. I want to just thank you for listening in, and we'll see you next time.